Hi, I'm Lynn Dreer, and I'm one of the nurses here at Bryant School District. And we're getting a lot of questions about COVID, and so we wanted to give you a few tips. Number one thing you can do for us to stop the spread of COVID at school is that if your child is sick, please don't send them to school. If they have any of the following symptoms: cough, shortness of breath, chills, sore throat, loss of taste or smell, muscle pain, and then other symptoms include fever, runny nose, diarrhea, nausea, vomiting, tiredness, headache, or poor appetite. If your child is showing symptoms of COVID at school, the nurse will assess them and then we will contact the parent. So please make sure all numbers are up to date in our systems. We will ask the 3 questions. Has your child been in contact within 6 feet of an infected person for at least 15 minutes in the past 14 days? Have you traveled to or lived in an area where the local reporting numbers are large? Or do you currently live in a high community transmission area while the schools remain open? If you answered yes to the screen, if they had symptoms, plus they answered yes to one of the 3 questions, then we will send your child home and recommend that you get testing. If your child comes back positive with COVID, we're going to follow the CDC and ADH guidelines. They will have to stay home for 10 days. They will have to be 48 hours fever-free without medication, and their COVID symptoms will have to have been improved. If you choose not to get your child tested, then your child will be assumed to have COVID, and those same 3 principles apply. If we just had a few symptoms but were answered no to any of those 3 questions, then what the nurses will do is evaluate, talk to you, call you. If it's allergies, if it's something else going on, they're just tired, didn't sleep, then we will do like we normally do in the nursing department. We will either send them home or let them rest in here or treat them here in the office. If your student tests positive for COVID-19 or receives confirmation from the health department that they have been identified as a close contact from someone outside of school, please call our district point of contact nurse at 501-414-6647. Another good thing you can do to help us here at school is to talk to your children about social distancing, wearing their mask properly, and how to wash their hands. Those are the 3 best things we can do to help the spread of COVID. And then another thing, just to keep the spread of germs from going home, any germs at all, not just COVID germs, is when your kid gets home, have them wash their hands, change their clothes, and if possible, take a shower. And then also leave your shoes they wore at school out in the garage or outside the door, and their backpack as well. That just keeps things from coming inside. If you have further questions related to COVID-19, please call 501-414-6647.